Well, Queensland's Chief Health Officer, she continues to dish out plenty of advice to keep the border closed, and the Premier's listening to her, but it appears they may all have a new internal battle to deal with. Ahead of the state election that's looming for October, the Australian Medical Association of Queensland wants doctors to take a stand against what they regard as inferior patient care. They've categorised it, as I said, as bargain basement medicine today, and they're arguing against the Palaszczuk government. Well, Dr. Bav Manoharan is Vice President at the Queensland AMA. He joins me now from Brisbane. This is always a bit of complex policy work, but I think it's incredibly important people understand what's at stake here. Bav, can you take us through the AMA's concerns?
Yeah, good evening, Peter, and thanks for having me on board. Look, I think it's very important that we start off by saying that the Queensland government and successive Queensland governments have for many, many years ignored our advice and ignored the advice of medical experts and health experts, and have made some pretty terrible decisions about allowing task substitution and scope creep to enter into the Queensland health system. And I think what we're seeing is this erosion of public confidence in the Queensland health system, and we're seeing an erosion of, I guess, our doctors and our nurses and our pharmacists and our physiotherapists' scope and their confidence to work in those systems. And
okay,
I think
give me some examples of scope creep. What do you mean by that term? And give me some practical illustrations of the point.
Yeah, one of the recent issues we've had is the government's attempts to legislate to allow pharmacists to prescribe. And now, on the surface, this might not seem like such a significant issue. However, we've got to be very careful. So they're doing a trial where women who have symptoms of urinary tract infections will be able to go to a pharmacist and get a script for antibiotics. Now, this flies in the face of evidence of all the experts about antibiotic resistance, and also the conflict of interest it represents for someone to see a health professional and then be prescribed and dispense the medication from there. Let's be honest, this is being pushed by the Pharmacy Guild. They represent small businesses and big businesses, but they represent businesses. They don't represent the pharmacists. We have had doctors and pharmacists both come to us and express their concerns about this. The pharmacists who are going to be caught in the middle of this are going to be left with the medical liability if they can't get the diagnosis wrong. So we're really worried about misdiagnosis and delaying care. These women who see these pharmacists may have other underlying issues that are not a urinary tract infection. They could have malignancies. And if we delay the detection of those, that's going to affect their outcomes.
Yeah, particularly some female-related cancers. It's a very real risk. Beyond the pharmacy argument, what else are you concerned about?
Look, there's a number of other things that have happened in Queensland over the years. Another is a trial for physiotherapists to dispense opioid or endone or morphine-based medications. Now, again, this flies in the face of all of the work that's been done in Australia to try and contain our...
Sorry, Dr. Babb, can I just jump in there? You're saying physiotherapists are prescribing opioids? Well,
that's the intent of the government's change to the legislation, yes. So rather than seeing an orthopaedic surgeon and getting managed for the appropriate condition and being assessed, they'll be seeing a physiotherapist and potentially getting endone. Now, there's two issues there. One is the delay of these patients accessing the care from a specialist, but also the issue about opioid addiction. It's a huge issue.
Absolutely. Massive issue. That is extraordinary. I hadn't picked that up before. That's terrifying. I have to say it's terrifying. What's the argument from the Palaszczuk government? Is this about cost cutting?
Well, it has to be. Look, there's a number of, it's an election year. We like to put our patients first, and we're not here to pick a fight with pharmacists. We're not here to pick a fight with nurses. We know that their representative groups and the unions and the Pharmacy Guild have been in the media today saying that's what we're trying to do. Absolutely not. Doctors work collaboratively with all of these people every single day. If it wasn't for these other people, we wouldn't be able to look after patients. And I think we have to appreciate that. Now, who we're picking a fight with is we're picking a fight with the substandard and the poor health policy that have been put out by successive governments. And we want to make sure that that's not seen through after the next election, whether each side wins. We just want to make sure that patients are put in the centre of Queensland's healthcare system.
I suspect a lot of people, my viewers tonight in particular in Queensland, have long memories of some of the pretty horrific health calamities in the medical practice area. Doctor death's a good example, Bundaberg Hospital in Queensland. What's been the response of doctors to this plea by the AMA to let's make this a bit of an election issue?
Oh, look, our members have been coming to us very strongly about this. And we represent public hospital doctors. About half our members are public hospital doctors and half of them are GPs and private specialists. And they've all been coming to us saying that the successive erosion of the medical practice and the way that healthcare is delivered in Queensland, it has to be an election issue.